Okay, I would be going to slide one, but a little introduction. Some know me and some have not met me. I am I'm a medical doctor. I was the first generation of graduates of physician surgeons from Morelos University in Mexico, 41 years ago this month. And I have various trainings, but I have a master's degree in nutrition in public health nutrition from Loma Linda, and also I'm currently board certified in family medicine, and also I'm board certified by the American Board of Physical Medicine Rehabilitation and Spinal Cord Injury Medicine. And I've also taken training both in general preventive medicine and occupational medicine, but I'm not certified in that area. So I'm on slide one. There was a series of at least four, and they're still having some Sunday evening symposiums as follow-up by the Adventist World Radio. And these were two-hour symposiums that they had going on starting, I don't know, a month or two ago. And so the slide one, we're going over the lessons learned from the 1918 flu pandemic. Okay, and there's the best treatment at that time was in the Army hospitals. However, data from the 10 sanitariums showed otherwise. In the Army hospitals, among patients diagnosed with influenza, 16.7% had pneumonia versus the patients in sanitariums. Among those diagnosed with influenza, only 2.4% had pneumonia. The death rate in Army hospitals was 6.7% versus 1.3% in sanitariums run by Seventh-day Adventists. Slide two. There was also used to be a Hutchinson Adventist Seminary located in Hutchinson, Minnesota. And there was a report by the health officer in that county, Dr. Fred Shepard, and he said that there's no public institution in the state of Minnesota up to date made such a record in handling influenza like that of the seminary. With 120 students and faculty under one roof, 90 developed symptoms and were treated carefully. And then slide three, with hygienic medicine, including hydrotherapy by Dr. H.E. Larson and his staff. As a result of this system of handling a disease that is scoring thousands of victims every day, there has not been one case that could have been serious or a single death in the seminary, although there were more than 90 persons affected. The record is remarkable, and it makes the ordinary methods of dealing with flu appear irrational. And slide four. Well, back on slide three, we know in the sanitariums they did a different type of treatment than the Army hospitals, and it was not only the hydrotherapy treatment with brief cold exposure, but it was also all the 8 natural remedies, including diet and also including trust in God, the only true God. Now, in regard, slide 4, in regard to COVID-19, there's 3 phases of COVID-19. There's those that are exposed, either known or unknown, and some of those went to 14-day quarantine, and if they knew that they were exposed. but they weren't tested to know if they had that or another viral illness. And then phase two, these are the ones that had symptoms or have symptoms and are infected. In other words, they were tested and they actually were, well, some were tested, some were thought to have it and then quarantined. 80% of these get better, and 20% go to phase three, and phase three is a hospitalization. So the question is here, what do we do with phase two people? Do they just sit at home and twiddle their thumbs and have marital relations because both spouses aren't working and they're getting on the other's nerves, or do they do they just if they're under increased stress, they didn't close all the liquor stores. They closed the bars, but not the liquor stores, so they can run out and get alcohol and take it home. And some of the things the quarantinees did at home didn't really actually cause them to go to phase three with hospitalization. So the question is, there something that the CDC and the public health departments could have done, and also can do now, to prevent the 20% from going to phase three? So there are that we as Seventh-day Adventists have an answer. We have the 8 natural remedies. Okay, slide 5. Let's review some physiology. Just in simple terms, we have an innate immune system that we have from birth, and this innate immune system, whenever we come in contact with a illness, viral or bacterial or whatever, it remembers what happened, and it produces memory cells and antibodies to fight that. When it comes around again, then it can stop it in its tracks. And then we have, and of course we have the adaptive immune system, which is acquired from, this is either from the, having an infection, like I said, that produces memory cells, which are lymphocytes, and also antibodies that are chemical substances to attack the illness. And of course, we know that they're trying to shove for a vaccine, which is really an artificial way of producing a memory system in your adaptive immune system. But any vaccine is not long lasting. It only lasts a few years, or it does not last a lifetime, like when you get actually the disease. Before, many people that are toward my age, before they came out with measles, mumps, and rubella, we had those as childhood illnesses, and if most people, if we took titers, we would have immunity to all those diseases. The natural way of doing things, rather than vaccines, produces a very strong titer, and it makes it almost virtually impossible to have the disease a second time, unless it's an entirely different strain. So slide 6. There was this is a study that they did among 12 healthy volunteers who were given whole body hyperthermia. In other words, the healthy volunteers were immersed in 39.5 centigrade water bath, and then they were examined, and it was concluded that the thermal effect of fever directly activates monocytes, which increases their ability to respond to bacterial challenges, also to viral challenges, which would be COVID-19. Slide 7. And they were also given hypothermia with a brief cold exposure. What happens when you're given a brief fall exposure? It gives a consistent and statistically significant mobilization of circulating cells and increase of natural killer cells activity and elevation of circulating IL-6 concentrations. But a lot of the people that aren't nurses or doctors won't know what IL-6, but it's one of those proteins that are produced when you come in contact with the viral or other type of infection or disease. It's something that's it's a protein that's produced to help fight off the infection or challenge. Slide 8. There was a study done in regard to fever and the thermal regulation of immunity. The study suggests that strategic temperature shifts contribute to biochemical feedback loop that protects tissues against damage from excessive cytokine releases during infection. In other words, there is proteins called cytokines that actually are released, and if these go out of whack and are not controlled, it can actually lead to more infection and even pneumonia and acute respiratory distress syndrome. I don't know, some have not heard that, but these are just more severe lung damages that happen with illnesses, especially in COVID-19. Slide 9. There was some studies done in different countries in regard to their total deaths that they have normally in the population, and then there was a percent increase that they figured was from the 1918 flu, and they studied Finland, Germany, Italy, France, Spain, England, and Wales, Portugal, Bulgaria, Netherlands, Sweden, Switzerland, Scotland, Norway, and Denmark. And all of these excess increases over their total baseline deaths were increased, but Finland had the lowest increase. And so the question would be, what is so unique about Finland? Well, if you look at Finland, about 99% of the population regularly takes sauna baths as a way of life. And some of those have they go into the sauna and then they have a pool of cold water that they jump into they're in a swimming suit in the sauna, and then they jump into the cold water for a minute or two, and that's a regular way of life that they have there. And so slide 10. So what about this? What is the real hypothesis regarding this external heat cold therapy? Studies have shown this is based on good evidence as opposed to sometimes some of the speculation in regard to the using of masks and quarantines that they have right now. But we have strong evidence that innate immunity can be strengthened by manipulating the external heat and cold therapy. Heating and cold seems to increase the markers of innate immunity. And the interventions do not necessarily seem to exacerbate the cytokine storm that would be implicated in acute respiratory distress syndrome and in pneumonia. It's not a panacea. It is based on evidence and rational scientific postulates. and the strongest evidence that is had is among Seventh-day Adventists that operated these sanitariums in the past. Slide 11. Right now we have a Dr. Eric Nelson. He's a surgeon. He's in Chattanooga, Tennessee, and he's doing some research in hospitalized COVID-19 patients right now. His protocol is 25 minutes of moist heat to the chest, and then a 1 to 2 minute cold applied to the chest for a thermal lock, and the frequency is 4 times a day. And some of the I don't have the preliminary statistics, but according to him, it's showing that their hospitalist COVID-19 patients, their percent going to pneumonia and acute respiratory distress syndrome is decreased from the normal population. Slide 12. What are the real lessons learned from the 1918 flu pandemic? Water is one of the 8 natural remedies, and when used properly, it can help prevent and treat viral infections such as COVID-19. And we do have persons that will, there are some Adventists that will come and train individuals how to use this hydrotherapy with brief cold exposure, but there might be even somebody in your camp meeting that can actually teach some of the people these techniques of how to do this, because we should have an outstanding record among us as Seventh-day Adventists, and us that believe in the only true God and His only begotten Son. And we should be an example to the world of how we live in regard to also applying the 8 natural remedies. Thank you, and if you have any questions, let me know.